Okay, good afternoon and welcome to the Real Talk Show. We've brought you another exciting episode of the Real Talk Show, and of course, we are discussing something very, very interesting. I bet a number of you have seen what has been happening on our page for the past weeks, and obviously, you've been waiting for such a show to come, and we are here to just bring to you another exciting episode where we can learn and have honest conversations. It's very important. Hi, Kover.
Hi, Margaret. How are you today?
I'm good. How are you doing?
I'm all right, thank you.
Nice to have you on the show.
Thank you for having me today. I feel very great.
Great. So, today's conversation, we're going to explore just how young people can go beyond the degrees. We know a number of young people are holding their degrees, but then after this show, you will be able to know what exactly you can do beyond that degree that you hold. And as you can see, we have so many different faces today on the show, and some might be a little bit familiar, but others are new on the screen. And these are the people that are just going to help us understand what the show is all about today. And not forgetting that this program is brought to you by the Zambia Health Employment for Youth in Action, which is their coalition, which operates through support with Amref Health Africa in Zambia under the Africa Health Collaborative Program, which is also implemented in partnership with the Mastercard Foundation. So today we're having an exciting topic. I feel like I'm going to be learning as well in this show. I'm not just hosting this show, but there will be some learning as well. So today's topic is beyond the degree, your health career reimagined. You get reimagined. So we're going to reimagine the degrees that we hold. And obviously at the end of the show, each and every particular person will be so eager to learn more and to just hear more shows about this and ensure that we learn one or two things. Before I talk much and before this becomes my show alone, I'm going to allow my guests, or rather our guests, to introduce themselves. They're going to tell us their name, where they're coming from, and of course their positions. So I will start with, since we have two ladies here, I will start with the gent. So Joseph, you can go ahead and introduce yourself.
I was thinking you were going to say ladies first, but okay, thank you. Good afternoon, everybody. My name is Joseph Mutale. I'm the Secretary General for the Biomedical Society of Zambia.
Thank you. Thank you for that, Joseph. And I will move to Melody.
Good afternoon, everyone. My name is Melody Yeti, and I'm coming from Young Women in Action. I'm a programs officer.
Thank you so very much, Melody. And Alice, you can go ahead.
Afternoon, everyone, and I'm glad to be here. I'm looking forward to our conversation. So my name is Alice Mapulanga, and I lead communications and partnerships at Amref Health Africa here in Zambia.
Thank you so much for that, Alice. And of course, I'm going to give my co-host, since this is the first time you're seeing him on the screen, I'm going to give him an opportunity to just introduce himself and where he's coming from. Kover, you can go ahead.
Hi, my name is Kover. I'm coming from Young Women in Action, and I'm the communications officer.
Thank you so very much for that, Kover. And lastly, we all know that we have that one person we don't get to hear from, but of course they get to help us just to ensure that the show is inclusive to each and every particular person watching. And today we're having Memory Zulu. Memory is helping us to just ensure that our friends out there that are able to just be part of the show and participate and engage. Thank you so much, Memory, for being part of this show. So, Kobe, I'm going to throw it right to you and help us just start our conversation.
All right. So, as Margaret said, so today it's beyond the degree. and the opportunities that strengthen both their careers and Zambia's health sector. I think my first question will go to Alice is, could you tell us what the Health Africa Collaborative Project is and what inspired its establishment?
Alice, your mic is muted.
Can you hear me now?
Loud and clear.
Okay, great. So I was saying, before we get into speaking about what the Africa Health Collaborative is, I think it would be very important for us to understand the organization that's behind the work of that collaborative, which is Amref Health Africa. And Amref is the largest African-led organization in Africa, and we have over 65 years of experience in terms of delivering programs that look to improve the health outcomes of the people on the African continent. And particularly in Zambia, we've been working since 2016 with the government through the Ministry of Health, other development partners, and communities to ensure that we strengthen the health system of the country, as well as improve access to quality health care in the country. So our work is centered around maternal, child, and neonatal health, primary health care, health workforce development, and supporting youths. And one of the ways that we do this is because of our vision, which is lasting health change in Africa. And we are bringing that to life through one of our programs, and that is the Africa Health Collaborative. So what exactly is the Africa Health Collaborative? So the Africa Health Collaborative is a flagship program that is being implemented by Amref in 3 countries in partnership with the MasterCard Foundation. So it is being implemented in Zambia, Kenya, and Senegal. And in Zambia, we are doing this through Amref, as well as 9 universities, 8 that are in Africa, and 1 is in North America. So the Africa Collaborative works closely with training institutions, with the government, through the Ministry of Health, through the Ministry of Science and Technology, and through the Ministry of Youth, Sport and Art, and through youth-led platforms such as the Zambia Health Employment for Action Coalition, which is one of the platforms that has brought us together. So the program recognizes that Africa has one of the youngest populations in the world, but then alongside that, we also face significant challenges in having a skilled workforce, particularly in health. And not because of the lack of the skilled workforce, but then it's because of the rate at which we can assimilate these graduating youths into the formal sector under health. So the program is built on a very simple but powerful belief that if we invest in young people, we can simultaneously strengthen our health system, as well as provide them with sustainable livelihoods, and also give them dignified employment and give them opportunities that allow them to build and to also look at how can they address the challenges that we're facing as a continent. And so as a collaborative, it came about to bridge that gap. And our work is centered around that, obviously, through various ways and through our various pillars as a program.
That is very interesting to know the background, and I think it's always important to know the history behind who is behind the organization and what they are doing. And the fact that you said that what you are doing is to improve the lives of young people in terms of health and entrepreneurship, it's what we need as a country as well. So kudos to that.
Exactly. That's very interesting, and I like the fact that Alice did not just go straight to explaining to us what the Africa Health Collaborative project is, but she definitely just went and just ensure that we understand who exactly is behind the project and what the intention is and what they currently looking at. Thank you so much for that explanation, Alice, or that response rather. So I'm going to move to Melody. So in responding to the first question, Alice mentioned the coalition, which we are calling the Zambia Health Employment for Youth Action. This is something that I think a number of us we've been seen on our Facebook pages where we are kind of tagging the page, tagging having the logos on our brandings and whatnot. So now I think it's very important that a young person who's watching out there, they are able to understand what exactly the coalition is all about. So from somebody who's hearing about this coalition, like the ZEA coalition as we abbreviate it, what is it all about and why was it formed? Melody.
Thank you, Margaret. So before I say anything, I have a really bad flu, so I might be sneezing in between. So the ZEA Coalition, it's a group of associations and civil society actors that came together to form this coalition, with the main reason of advocating for young health professionals, creating health entrepreneurship pathways, and also advocating for employment. I think like what Alice said, that we do not have the capacity to assimilate all the young health professionals because these young people are graduating almost every year. So we're trying to come up with ways in which they do not rely so much on formal employment, but also come up with ways in which they can also be employers at the end of the day. So just to speak a bit on the ZEA Coalition, it consists of 8 medical associations and civil society organizations, like I said. So I will not mention all of them, but then the reason why it was a combination of, you might be wondering why CSOs and then these medical associations, like how do these people even work together? We believe that each organization or medical association, it brings its own uniqueness. So we complement each other in that way, in the sense that civil society actors have this experience in advocacy work, and then it also brings in the knowledge from these young health professionals. Like these medical associations are a representative of these many young health professionals that are on the ground. So it also helps us to tailor suit the interventions to address the problems that are on the ground relating to the issue of youth employment in the health sector. I don't know if I've answered your question. Thank you.
Yeah, that was interesting. Also, what's interesting about that, Melody, is that ZEA is a coalition of CSOs and medical institutions. And my next question comes to Joseph. As part of the coalition, the Biomedical Society of Zambia is part of the Zambia Health, that's ZEA. And what role does it play in advancing its objectives?
Okay, thank you for that. So the Biomedical Society of Zambia, it's being more a representative of the biomedical professions on the ground and the youths that we have on the ground. We have a very big role in the coalition. So our role is more of just bringing a voice of the young health profession to the coalition. Like Melody had mentioned, the coalition is comprising of quite a number of associations from different backgrounds. So now, how do we get our people to behave there if we're not there? So the Biomedical Society of Zambia sits on that table so that we are able to make sure that we advocate for what our youths need. Now, we are advocating for youth employment, and this is not just for the biomedical professions, but all the youths in general and the health sector, and ensuring that biomedical graduates access internship, mentorship, and career opportunities. So we are having opportunities where we're discussing policy briefs, where we are talking to members of parliament to make sure that the graduates get opportunity of a career at the end. But like it was mentioned earlier, we are unable to absorb all the graduates that are coming out every year. We are unable to absorb all of them at once. So what we're doing is we're doing our level best to make sure we bring entrepreneurship skills to our members and our youths. That way they can be able to stand on their own without relying on being absorbed by the system. Basically, that's that. I don't know if I've answered the question.
Perfectly done. I think my key takeaway from what you've said is, as young people, we just have to be creative. It's not every time that the government will provide us with employment, but once we have enough skills as young people, we can become entrepreneurs, and that's what we need as youths, even to take this nation to the next level in terms of the health career. So thank you for that, Joseph. Yes, you've answered the question. All right, I can see Margaret dropped off. I think which leads, I think my next question will go to Alice. Alice, the project also focuses on 3 key thematic areas. So that is health employment, health entrepreneurship, and health ecosystem. Could you explain what each of these means and why they are so important?
Thank you, Joseph, and absolutely. So on the project, we call them pillars, but like you've rightly put, they could be referred to as thematic areas. And these areas are closely connected because we believe that addressing youth employment in healthcare particularly requires more than creating jobs. It's about strengthening the entire system that supports young professionals throughout their careers. So health employment, in that we recognize that every year Zambia produces highly qualified professionals, yet many struggle to get into formal employment or transition because of the high demand of jobs is exceeding the number of available positions that we have. And while the government continues to invest in health workers and the recruitment of health workers, the reality is that formal employment alone cannot absorb the numbers that are entering the workforce. So this means that a lot of young, talented people are going to be unemployed despite having the skills that the communities urgently need. So our focus is therefore not only about employability, but then also preparing the young professionals for the realities of the labor market today. So through the collaborative, we are looking at how do we support young people to strengthen their leadership? How do we support them to strengthen their communication, their soft skills, their digital literacy, their innovation, and their problem-solving skills, alongside the technical qualifications that they have acquired, making them more adaptable in the market, more competitive, and more employable. The second pillar is health entrepreneurship. And this pillar is particularly focused on that. We want to shift our mindset from the traditional view of working in a hospital, working in a clinic, and working in a government facility as a health worker, to now thinking about how do you establish yourself outside those pathways that have been the traditional line of thought for a lot of young people. So we want young professionals to establish digital health platforms. We want them to establish rehabilitation homes. We want them to have home-based care services. We want them to come up with innovative solutions that address the challenges that the communities are facing, but then also allows them to turn those challenges into opportunities, thereby not only creating livelihoods for themselves and their fellow young health professionals, but also improving access to healthcare for their communities. And the third pillar that we have spoken to is health ecosystem. So we recognize that no one government, no one single organization, no one single association or even no one single youth group can address this challenge that we're facing today. So we know that government develops policies and regulations that regulate the health sector. The universities and the institutions are training these health professionals. How do we bring those two together to the table with the development partners, with communities? And how do we then, as a collective, look at addressing this issue? And how do we make the environment favorable for youths to then look at what are the opportunities available and how can they navigate that, to set up businesses, to start their own enterprises, to build solutions for the challenges that are in their communities? And how do they bring those ideas to life, and how do they scale? So we as a collaborative are bringing all these actors together because we want to see lasting health change on the continent, but we want to see the change driven by the young people for the continent. And when we create a stronger ecosystem, we are then able to have better coordination, stronger partnerships, more innovation, improved services, quality health services, but also ensuring that the youths who are in the health space have sustainable and dignified jobs and dignified opportunities that are able to sustain their livelihoods today, tomorrow. And then because of those opportunities that have been afforded to them, they are then able to extend those opportunities to the next generation that comes after them. So together, the three pillars are basically helping build a health workforce that is skilled, that is inclusive, and that is equipped to respond to the ever evolving challenges of the country in the health space and the continent, and to respond to the future needs that will arise. Over to you.
Okay, thank you so much for that, Alice. I know maybe to somebody who's watching or somebody who's listening, it might seem like it's a lot of information to grasp at once, but I feel like as the campaign goes on, you are fully going to understand what we are trying to communicate and what exactly we aim for at the end of the day. Thank you so very much for that explanation, Alice. And I have seen that our comment section is buzzing. People are watching from, we've seen people watching from Livingstone, Lusaka, Bulangida youth-friendly space in different parts of the country. Thank you so much for joining us today. But we want you to tell us, we want you to engage by asking the questions. We have an amazing panel today. And of course, we want to listen to the questions that you have, and they'll be able to respond to those questions. Thank you so very much. So we have a comment here, and it says, thank you, Alice, for that introduction. As a young person, I'm looking forward to learning more about the collaborative. Thank you so very much for that comment. You can keep your comments coming in the comment section, and we'll be able to read them. And if you have any questions, we'll still just give them to our guests. So we have another one from Brian, and Brian says, Alice, I appreciate you. I appreciate how you highlighted both positioning young people for the job market and promoting health entrepreneurship. These areas are indeed interconnected and essential for sustainable development. Thank you so very much for that comment, Brian, and you can keep commenting, and if you have any questions, as I mentioned earlier, our guests will be able to respond to those questions. So I'm moving on to Melody. So Melody, Alice has mentioned in her explanation, she mentioned something to do with collaboration. And of course, when we look at ZEA itself, it brings together diverse stakeholders from different organizations and institutions. So I'd like you to just help us understand, why is collaboration important in strengthening the health of ecosystem for young people, and how does the coalition implement the work of Africa Health Collaborative Project in creating opportunities for young people? Melody.
Okay, Building on what I said earlier on, that each medical association or organization brings its own uniqueness. So that being said, even when it comes to our interventions, we rely on each other's strength. So, for instance, like what Joseph said, that they represent young health professionals that are under the Biomedical Association. So they bring forth their plights, like whatever needs to be addressed, of course, relating to the issue of youth employment. And this helps us come up with better interventions. So with the collaborative and the coalition as well, we do have pillars, the pillars that Alice talked about. So you'll find that within our coalition, each organization, you can't be everywhere. So each organization is under a specific pillar. So this also helps us with the programs that we come up with, the interventions that we come up with. Each organization or medical association just focuses on a specific pillar. I don't know if it answers your question.
Yes, it does. Thank you so much, Melody. Thank you so much for that explanation. Of course, just as you mentioned, to say a single organization cannot separate itself in just handling different things, but looking at the fact that this project is working with different organizations and institutions, it helps us understand even where exactly the gap is and how best this can be worked on, depending on each organization and each institution that we're bringing on board. Thank you so very much. Kover, do you have anything to say? I feel like I've spoken a lot.
For Melody, no, but I think based on what she said, I think which is what leads me to another question that's for Joseph, because she mentioned about each organization, each coalition member, they fall under a pillar. And my next question, I think, goes to Joseph. Since they're into biomedic, and as biomedical professionals, are essential for delivery.
On the call.
Oh, Joseph is not on the call. Oh, all right.
He's
Then
not on the call. I think Joseph has dropped. But I can see that we have a number of questions. We have a number of comments in the comment section. Maybe you can go ahead and just read some as we wait for Joseph to come back.
Oh yes, there's one question that I saw that got my my attention from Muida. I think the question goes to Alice, and it goes by Madam Alice. I'm asking, are there current activities that support health innovations? If so, how can I get in touch?
Thank you, Kover, and thank you, Muila, for that question. So I wouldn't say there are current activities that support innovation. The entire program is built on supporting innovation. So in terms of how can you get in touch, one of the ways is what idea do you have and who is the closest organization that you can get in touch with to then get in touch with us, whether it's TYP or it's through the coalition. And I'm sure our organizers are able to share that information, and those ideas can be shared, and we can see, is this an idea that is scalable? Because at the end of the day, we still need to look at, is this an idea that is, one, addressing a current issue? Is it scalable? And is it an idea that we can then get behind and support? But otherwise, as a collaborative, as Amref and as ZEA, we are open to listening to all the ideas that are available, and that support looks different. Is it support in that we connect you to mentors that you need to build on your idea such that it then becomes a workable idea? Is it connecting you with networks that are able to provide resources, whether it's human resources to build your business, or is it financial resources to scale? So support looks different, of course, and that is based on the idea you have and the needs that you have as an innovator, or whether it's with you and a group of your peers that you're with.
Oh, that's wonderful, and that's well put together. And I think also another question from Andrew. This one I think I love it, because I was also asking myself that question. when you are in Lusaka, Lusaka is a land of opportunities. And then when you are just outside Lusaka, you may be disadvantaged. And Andrew goes by, this I think goes to anyone. How can young people from disadvantaged backgrounds compete for opportunities when they may not have the same resources or networks?
Okay. So with regards to that question, yes, I do understand the field may not be the same, it may not be even, but then the beauty about the Africa Health Collaborative Initiative is that it seeks to provide opportunities for everyone, regardless of your background or where you're coming from. It's just an issue of having access to internet, and then you can actually build your own capacity. Building on what Alice said, we actually have AHC courses. So these are self-paced. You don't even have to pay anything to enroll for these courses. You don't even have to pay to be a part of some of like the networks that we have. We recently had a village saving group for young health professionals. This was an effort to build their capacity in terms of financial literacy and also the startups. So you don't really have to pay anything to be a part of it. So it's just a matter of having access to the internet, and then you're good to go, you're set.
And before we move on from that, I just want to say, right now we're getting comments from our listeners and whoever is watching us from Facebook, from LinkedIn. You know, when you're on those platforms, take advantage of the digital space that we're in. Amref Health Africa is on Facebook. We are on LinkedIn. We are on X. Africa Health Collaborative is. So is TYP. So is there. Instead of just scrolling through for the fun of it on most times, look at what organization is doing what. And if you hear about opportunities, there is nothing wrong with you sending a message to their inbox. And of course, these messages have to be targeted. You can't just send a hi and expect to chat with an organization like you're chatting with a friend. So put all your information, your name, your details, what your idea is, what kind of support or what opportunities you're looking for. As organizations, we always look through the messages that we receive. And when we see someone who's very intentional about what they are looking for and about opportunities that are available, those are the messages that you find. We will be able to respond to you and say, okay, right now we don't have any opportunities, but then maybe in the next 3 months, in the next 6 months, this will be happening. Would you be interested? Or we'll then respond to you and say, these are the people who will then be able to directly support you. So get in touch with those. So let's use even our social media in a way that is able to open those opportunities for us. You can be in Livingston. We might not be operating directly in Livingston, but then you can share those messages. You can write to us through Facebook or through WhatsApp with any of the details that are given. And even the courses that Melody has spoken about, this is information that is available on a lot of the social media platforms. So if we can also use that and take up those opportunities and take advantage of that, that will then allow us to have access to most of these opportunities, regardless of your background, regardless of where you are based, whether it's Lusaka or Mumbwa or Chongwe or Livingston.
Thank you so much for that, Alice. And today is just the first day of this campaign and having such a show. And I feel like at the end of the campaign, a number of people will have so much information on how best they can just join. I know a number of people get to ask, how can I join? How can I do what? But as we go on with this campaign and the shows like this, a number of us will have an idea of where exactly and how you can just attend and join the masterclasses that Amref provides, and how best you can just, work around the opportunities that are presented to us. Thank you so much for that highlight, Alice. And Kover, you had a question for Joseph before he disappeared. Now that he has reappeared, please, you can ask him the question that you had for him.
Hi, Joseph. Welcome back.
Thank you. Don't worry, I'm not going to.
Before you left us, you left a proxy. Melody spoke about each organization falling under a specific pillar, and it's got my attention that I'm not into all this medical and all this stuff, but from my understanding, your organization does with biomedical, right? And biomedical professions are essential to delivering quality healthcare, yet many people know very little about this profession. Could you explain what biomedical professions do and why their work is so important in addressing health-related issues?
Okay. So, before I tell you what biomedical professions do, allow me to just tell you what Biomedical Society of Zambia is just a little bit. So, Biomedical Society of Zambia, we're a non-profit scientific organization which is dedicated in making sure that biomedical professions are heard and understood. Now, to understand this, you need to know who we are exactly. Who is the biomedical profession? So, a biomedical profession, or what we do, should I say, in simple terms, we are the backbone of diagnostic medicine. You know a body, a human body, and we know what a backbone is. You will not survive with a backbone. That is what we are. We are the backbone of diagnostic medicine, working in the laboratory to detect, monitor, and prevent diseases. Just in a nutshell. Now, we perform critical tests such as microbiology, hematology, biochemistry, and these guide your doctors in patient care. So, literature has it that 70% of all the diagnostic services that are happening in a health facility already made from the laboratory. That is where it comes from. Now, our work is to ensure accurate diagnosis happens, safe blood transfusion takes place, outbreak detection, and quality assurance in healthcare system. I'll give a very clear example of something that we have experienced as a country. We've had cholera and we've had COVID. The people who examine to tell you that actually what you have is cholera and what you have is COVID are the biomedical professions. We are the ones in the background and most people don't really know what we do, but this is what we do. Without the biomedical professions, clinical decisions would lack evidence-based support. So it's more like you're just guessing without the biomedical profession. So that is basically who we are.
Okay.
Are you there,
Great.
Kover?
Thank you. Thank you so much for telling us who you are and what exactly you do. So before you even rest a little bit, Joseph. So from your perspective, you've mentioned a number of things on who you are, your profession, and what. And so what are some of the key challenges that's affecting the key challenges that affect the biomedical profession and young people aspiring to join the medical field? I mean, looking at what we are focusing on, obviously we're looking at the three pillars that Alice just mentioned, and then we have a young person out there who is aspiring to join the biomedical field, but then they might not have so much information about it and whatnot. So now I'd like you to highlight some.
Are you there? Can you get me?
I can hear you now.
Oh, okay. I thought I did another noob cyborg thing. So you were asking about the key challenges that we're facing in line with the three pillars that we have as a biomedical profession, right? So
Definitely.
the one thing that can point out, I think the main thing right now is our youth unemployment. Youth unemployment has been a major thing that we're facing as a biomedical profession, because we have quite a number of youth out there who have been graduating for quite some time now, and they're unemployed. Even when we see the recruitments that are happening under the Ministry of Health, you find like in the previous recruitment we had about, if I'm not mistaken, 147 laboratory personnel that were recruited against about 700 plus unemployed, which still leaves us with a huge number unemployed. So youth unemployment is a very big problem, and we are lacking structured internship programs as biomedical professions. Then we're also facing policy gaps in regulating biomedical practice and ensuring continuous professional development. So now these are some of the things that we are really trying to put up to make sure that they are addressed. Of course, with the help of ZEA and Amref, we are hoping these things can be catered for clearly. And there's also an issue with just the career pathways. Most of our youth entering biomedical profession without knowing exactly where they will head. So there's no clear career pathway for them other than just working in the laboratory, while it's not knowing that there's actually a lot that they can do out there, and some resource constraints in the laboratories, especially when we're talking about the rural district facilities. Yeah, the rural district facilities also have challenges when it comes to resource constraints. So basically, that's that. I don't know if I've answered the question. Can you hear me? I might be.
We can hear you, Joseph.
Yes, we got that, Joseph. Thank you so very much for that response. And I still want to go back to our online community. We are here, and today we're discussing a very, very important topic. And of course, we are looking at Beyond the Degree and your health career reimagined, which is brought to us or supported by Amref Health Africa in Zambia. And of course, we have a comment here, and it says, I think this is Andrew, and Andrew says, how can young people turn their skills, passion, or community problems into career or entrepreneurship opportunities? This is an awesome topic which young people have to be equipped with. Thank you so very much for that question. So I'll throw this question to Alice. Alice, did you take note of the question? How can young people turn their skills, a passion, or community problems into career or entrepreneurship opportunities? Alice, you can go ahead.
Okay, thank you, Margaret.
So
one of the ways that we can do this, and I know traditional thinking is always, if you have an idea, you want to first have the money to get started, right? So when we address a challenge in our community, you're thinking, what is the problem that we are facing? How can I solve that problem? So let's say, for example, the problem of information for young people. We are in a digital world where you are then able to create a platform that is able to provide this information. Now, of course, we can never do anything alone. So how do you turn this into a career, or how do you turn this into a business? Who are the people who can help you bring this to the next level? You have the idea, you need to put it down on paper. You need to look at how scalable is it? Is it only for your community, or is it something that, let's say if your community is Lusaka, is this something that can then be replicated and work for youths in Chongwe, youths in Southern Province, youths in the Eastern Province, right? And you find that these are not only isolated incidents or isolated challenges. You will find there are youths in Malawi who might be battling with a similar challenge as well. So is this something that then can be scaled from a Zambian perspective to even a regional perspective, maybe sub-Saharan Africa, or maybe the entire continent. One of the ways that you can do that is also ensuring how do you then connect yourself with networks that are able to bring this idea to life. And this is where Amref and the collaborative comes into the picture. And of course, we are not the only organization that is doing this work, but we are very intentional about being very youth focused and particularly supporting youths and their ideas so that they are able to turn them into a long career as well as a sustainable way of earning a livelihood. So get started with your idea, put it down on pen and paper. If you're able to do prototypes, you are obviously, that is one way of going about it. And one of the things that we have around the country are innovation hubs as well. Are you able to get in touch with one of those innovation hubs that can then help you also refine this idea? I think I've spoken about using the internet and social media to build ourselves. So can you also find a community on any of the social media platforms that can help you build on your idea or your entrepreneurship skills? And ultimately, you will then find a path that then leads you to the ultimate goal of having something that you can say you have built from the ground up, and you are then able to build into a long-standing business.
Just an
Thank
addition
you.
to that. I like the
Yes, Joseph, you
way
can go ahead.
Andrew is thinking. Andrew is visioning something that can be done in a very good way, and he needs a guidance. So now, not just to Andrew, but to everybody else, I think my colleagues here have mentioned something that is very important for young people. Aside you just getting your pen and you start writing, maybe you may not know what you need to write, but this is the reason why we have the AHC short courses that are free and available for you. These will guide you on what you're supposed to do. They will guide you on how you're supposed to do your resource mobilization, how you're supposed to jot down your business plan, and how you're going to just go about the whole thing. This might be something that is very helpful to you, and you might need to just acquire these. How to reach them out, I'm pretty sure I will announce at the end where you can get these. Thank you.
Okay, I can see Margaret dropped off. And I think speaking, I think from opportunities, I think my next question will go to Melody. I think I've come across this question young people will ask, and you might not know what to answer, but I think it's good that we have Addis, we have Melody, and we have Joseph here. And the question is, how does the coalition complement the work of the Africa Health Collaborative Project in creating opportunities for young people?
Okay, so the coalition does not work in isolation. We complement. Basically, there's no coalition without Africa Health Collaborative. There's a correlation there. So how we complement as a coalition, I think I'll just keep on referring to something that I said earlier on, to say all the organizations and the medical associations that make up the coalition, they are representative of the larger population of the youth. Referring to the young health professionals. So how we complement is that we bring forth the challenges these young health professionals face. I'll give an example, like with regards to the issue of navigating HPCZ registration. So it is through the representatives from this association, they brought forth that, okay, our members are facing these challenges when it comes to registration. How best can we move forward? How best can we make it easier for these people to do their registration? So the coalition is a representation of the young health professionals. So that's how we complement the Africa Health Collaborative Initiative, that we bring forward the plights and then seek to address and advocate for the young health professionals, be it in terms of policy change, be it in terms of employment creation. It's on all levels, down to the individual, whereby we're trying to promote the Africa Health Collaborative short courses for continuous professional development for each and every young health professional.
Very interesting. So for the people that maybe are listening and they don't know about these short courses, how can they access, how can they get more information about these short courses? Are they free as well?
Okay, so with the short courses, yes, they are very much free. You don't have to pay anything.
I don't know if it's just my network. Are you able to hear me?
Yes.
Okay, thank you so much. My network is misbehaving today. It keeps in, but looking at the time, we're supposed to be winding up, and as we wind up, if our online community has any question, if you have any question, any clarification you need, or any contribution you have towards the show, you can just drop it in the comment section before we say bye-bye and leave you with that burning question that you want to ask, maybe Alice, maybe Joseph, or Melody. Okay, so I have a comment here, and it's coming from Sichone. So Sichone says, interesting topic. Looking forward to hear more from the experts and ideas that will be strongly shared. Kitwe District, Wellbeing Youth Friendly Space. Thank you so very much for that. Is here, and you are going to have a number of shows that you are going to learn from. And this comment is coming from Kimberly, and Kimberly says, thank you, Alice. I appreciate how you connected employability, health, entrepreneurship, and youth empowerment. These are powerful pillars for transforming the health sector and creating meaningful opportunities for young people. Thank you so very much for that comment, Kimberly. And thank you for highlighting some of the things that you think are very important that you've picked from the discussion. Mark says, loving the discussion. Thank you so much, Mark, for joining us today. And as we wind up, we are winding up. As you wind up, you can still ask your questions and just tell us what you think about the discussion of today and the questions that you have for our guests. So I have another comment here from Miranda, and it says, this is an informative topic. I urge all young health professionals to utilize the opportunities provided through this program. And of course, this program has so many opportunities for young people. I mean, Alice, I don't know if it's Alice or between Alice and Melody mentions to say this program provides free masterclasses that young people can benefit from. So stay glued to the page and just stay glued to the shows. You'll be able to know when exactly the classes are starting. And of course, you have an idea and you'll be helped on how best you can just be part of the classes without paying anything. I mean, we're creating opportunities for young people. So we're not going to make you pay, but we want you to get the knowledge and the skill that you need at the end of the day. So before we close, I'm going to go to, I'll go back to our, I don't know who exactly. Okay, so I have a comment here put again, is Lufo. It says Lufo, yeah. So how will young people benefit from the program? So that's the first question. And how do you support youth with different visions? Those who want to go beyond health and employment and instead create jobs for their fellow youth to help reduce unemployment. So I have to pick like who's going to respond to this question, and I feel like Alice will be the best person to respond to this. Alice, are you able to respond to this?
Yeah, sure. So in terms of how So in terms of how the program is built for you. The Africa Health Collaborative's main target is youth. Of course, we also look at how do we make the program inclusive and how do we ensure that we also support young women. But the main target for our program is the youth. So first and foremost, that is how you benefit. And we are looking to support youths in various ways, some of which have been spoken to. The short courses that are available online and free, you can simply Google Africa Health Collaborative short courses. You can go to the Amref Health Africa in Zambia social media pages. You will find information on that and how you can enroll for those courses. We are also offering various platforms supporting young innovators, whether it's through supporting them on platforms that allow them to showcase their ideas or speak to possible investors, whether it's through the It's Copala. We also have a flagship program which is called Afya Fest, and it's also looking at how do we bring youth innovators, African innovators together. The first one we had was held in Kenya. The last one we had less than a month ago was held in Senegal. And we had 3 youth innovators that we supported to go to that platform. We also have master classes, and next week we are starting a webinar series as well. Again, you can go to our social media platforms and you will find information on that, and you are able to register. So the opportunities are there in terms of how you benefit. It's about how intentional you are with accessing some of those opportunities and benefiting. So go to the various platforms that I've mentioned, whether it's LinkedIn, Facebook, or X, and simply using Google, you find some of this information available. So enroll for that webinar series that we are having. This is something you can take from the comfort of your home, wherever you are. We're also going to have some master classes that will be done online. Up until now, a lot of the master classes have been in person. So you have to get an invite, obviously. And what we try to do is we try and cushion the cost for attending those master classes. So they are free. We provide the support for your transportation, your accommodation, and to attend those master classes. But we obviously understand we are able to only reach a limited number through that model. So we are now looking at how do we provide online masterclasses. And these are masterclasses in entrepreneurship, masterclasses in resource mobilization, masterclasses in how do you bring your idea from ideation to implementation, and what other stages can we then provide support with. We have a program that is an internship program. How do we then support people who are looking to get into the formal employment pathway, be more employable by giving them access to opportunities to get experience, right? So there are all these various ways that you're able to benefit. And like I have said, ultimately the Africa Health Collaborative and Amref as the implementing organization is solely focused on supporting the youth in the various ways that we can, through employability and through entrepreneurship. And we are looking forward to working with ZEA, with the various other organizations like TYP and Young Women in Action, and the coalition itself, to say, how do we come together and how do we form an ecosystem that is able to deliver in the best way possible and reach the biggest number of youths, so that we are able to then reach our goal and achieve our objectives as Amref, achieve our objectives as the collaborative, but then also help the youths achieve their objectives with what they want to do for themselves. And again, I have spoken about the fact that we do not look at creating a business and providing employment as 2 separate issues, but as one. Because when we help a youth create a business today that is able to scale and expand for the next 5 years, we are also looking at the fact that that business will then be able to employ people in administration, people in ICT, people in, if it's a health service, people who are clinicians or people who are biomedical experts. So it's a whole ecosystem that ultimately is able to give all these various aspects and is able to support youths in different ways.
Okay, thank you so Thank you for the response, Alice. And I guess you've highlighted most of the things. You've gone ahead the campaign itself, and you've kind of like touched a number of things that you are going to discuss as we progress with the campaign itself. And looking at time today, I feel like time is really, really moving very, very fast. I don't know if it knows that we are discussing something very important that people really need information on. But either ways, looking at the time, of course, we have to close so that we can ensure that another person is able to watch this show and watch it to the end. And when it's too long, they cannot watch it. So I just want to appreciate our guests today for joining us on this important show, and for the information that you've provided, the information that you've shared with young people, and of course the opportunities that you've just highlighted. And I bet I'm also excited about what we're yet to learn from you, and what is coming ahead of us during this campaign. And of course, our audience today has been so very amazing. You've been interactive, you've been engaging, and you've been asking questions that are very important, questions that you need answers to. And of course, a number of you might still have more questions that you want to ask our guests here. Don't forget that the comment section is always open for you. You can still drop your comments in there, and we'll be able to respond to you. And if not, you can just still again join us next week as we come with another interesting topic, and of course interesting opportunities that Amref is providing, and the project, the AHC project, that is providing as a whole. Thank you so very much to Joseph for joining us, Melody, Alice, and of course my co-host today. My co-host was doubting, but he has actually done very well today, and I just want to say thank you so very much, Kover, for being part of the show today. Otherwise, it's a goodbye for now. And